Zinc is one of those rare nutrients that shows up in multiple parts of the pharmacy. It's in cold remedies, acne creams, diaper rash ointments, immune-boosting pills, and more. But not all zinc is created equal, and how you take it makes a huge difference in how well it works. Whether you're trying to fight off a cold, heal a wound, or give your immune system a little extra love, the form of zinc you choose, lozenge, tablet, or topical, can be the difference between, hey, that helped, and did this do anything? Let's start with lozenges, the darling of cold season shoppers. These little dissolvable discs often contain zinc acetate or zinc gluconate, two forms that have been studied the most for shortening the duration of colds. The idea here is simple but smart. By slowly dissolving in your mouth, lozenges let zinc bathe your throat and nasal passages, where cold viruses love to set up shop. Clinical trials show that, when taken within 24 hours of symptom onset and dosed properly, around 75 to 100 milligrams of elemental zinc spread over the day, these lozenges can cut cold duration by about 30%. But there's a catch. They only work if the formulation is right. Zinc bound to acetate or gluconate seems to release free zinc ions more effectively. Other forms, like zinc citrate or zinc bound with flavor masking agents, often don't have the same punch. Also, not all lozenges are pleasant. Some taste metallic, others cause nausea, and many try to hide the flavor with so much sweetener that your cold may go away just as you develop a cavity. But if you can tolerate the tang and get the right form, lozenges are arguably the fastest-acting way to use zinc for immune support. Now, what about tablets or capsules? These are the go-to for general supplementation, whether you're trying to correct a deficiency, support hormones, or improve skin health from the inside out. In this category, bioavailability, how much zinc your body can actually absorb and use, matters more than brand names. Zinc picolinate, zinc citrate, and zinc bisglycinate tend to be better absorbed than the old-school but common zinc oxide, which is cheap but poorly absorbed. Zinc sulfate sits somewhere in the middle, effective but more likely to cause stomach upset. For daily maintenance or targeted correction of mild deficiencies, tablets are reliable, especially when taken with a meal to improve absorption and avoid queasiness. Then we have topicals, creams, gels, and ointments where zinc shines in a very different way. Zinc oxide, the chalky white paste found in sunscreen and diaper rash cream, doesn't absorb much systemically, but that's the point. It sits on the skin, forming a protective barrier that soothes, heals, and deflects irritation. Topical zinc also has antimicrobial and anti-inflammatory properties, making it useful for acne, eczema, burns, ulcers, and even small wounds. In acne products, zinc PCA, pyrrolidone carboxylic acid, is sometimes used for its ability to reduce oil production and calm inflamed skin without the drying effects of harsher treatments. What topicals don't do is fix an internal zinc deficiency or support immunity. Slathering zinc on your face won't help your testosterone levels, won't shorten your cold, and definitely won't help your pancreas make insulin. It's great for the skin, and that's where it should stay. So, which zinc is best? That depends entirely on your goal. Fighting a cold? Go with a zinc acetate or gluconate lozenge, and use it early and often, but only short-term. Don't keep chugging lozenges for weeks. Supporting general health, hormones, or preventing deficiency. Stick to zinc picolinate or bisglycinate tablets. Healing skin, calming acne, or treating rashes. Bring on the zinc oxide cream or zinc PCA gel, and maybe spare your pillowcase with a towel. Each form of zinc has its moment to shine, and none of them are one-size-fits-all. Whether you're swallowing, sucking, or slathering, it pays to be picky about which form you use and why. After all, zinc may be a humble mineral, but in the right format, it's got some serious range.